Thank you all for joining us for December's meeting of the Disabilities and Conditions of Aging Network. So you are aware we are recording, and I always forget to ask this. I'm trying to be better about it. Does anybody need me to turn on the closed captioning? Okay, I'm getting.
I'll take the captioning. Yes.
Okay, now I have to figure out how to do that. Let's see. So where do I find that? Do you know, Krista?
I don't, because it's not on my screen and I'm not the host. Anybody else? It's not the end of the world if you don't. But it is preferable for me to be able to keep up.
I need to find that. It should be at the top of your screen. Okay. Now I'm up at the top. Because this is one thing that we've not done when we should. Do I need to go to full screen to see it? Maybe.
Maybe, and it might be like 3 little dots, depending on the device, depends on how your screen looks. So it's different if you're on a phone versus a tablet versus a computer.
Yeah, I am on, so I'm going to look for that. Oh, wait. Oh, there's all sorts of instructions coming in. Thanks, Jamie. Okay, let me get us going, and then I will get that in motion as quickly as
you are all good. I appreciate it, Jeremy.
No, that's fine. But yeah, once Maria starts telling us about the Alzheimer's Association, I'll get into that. But so folks know, again, this network was created because really throughout COVID, we saw lots of networks pop up, but nothing that was specific to nothing that was specific to disabilities and conditions of aging. And we decided to put the two together because really, as we age, disabilities present themselves, conditions of aging present as disabilities. So with that, I'm Jeremy Warriner. I wear 2 different hats. One is with my own organization, Walking Spirit, where I am available as an inspirational speaker and a accessible diversity, equity, and inclusion consultant and trainer. And then I also wear another hat as an outreach consultant for Advocates Personal Care, which is a Medicaid waiver service provider that provides attendant care, specifically a service that allows us to pay family and community caregivers of people who are on the aged and disabled waiver. So with that, today we're going to have Maria Holmes and John Johnson from the Alzheimer's Association share with us and do a highlight on that. We're also going to have Ina Picard later spend some time talking about Kids First and advocates and how we got here from her perspective. And then in between that, we're going to today do the kind of your speed round of practicing your 2-floor elevator speech about who you are and what you do. So with that, Maria, John, I will hand it over to you while I figure out how to get the closed captioning going. So.
Thank you, Jeremy. Can you hear me okay?
Yes.
And you can see the screen?
Yes.
Perfect. Okay, that's half the battle. Thank you so much for giving me a little bit of time. Yeah, my name's Maria Holmes. I work for the Alzheimer's Association's Greater Indiana chapter here in Indianapolis. I've been here about 6 years. They've been paying me. Before that, I was a volunteer. So I'm going to diligently keep to time and just tell you a little bit about the work that we do. I do have my colleague on as well, John Johnson. I think this is day 11. He's been with us. It feels like he's been here a lot longer, which is a good sign. He's a program manager for the Metro Indy area. So yeah, we'll get straight into it. So So we are a national organisation. So our home office is based in Chicago. We're the leading voluntary health organisation in Alzheimer's and dementia care, support and research. Across Indiana, we serve 73 counties. We don't serve the very bottom counties. That's done by our colleagues in Kentucky. And to do this, we have 20 staff. We did have more before COVID. We had about 26, but obviously during COVID, like so many organizations, we had to furlough and eventually lose 6 staff. But we can't possibly reach everybody that we need to reach without the commitment of some wonderful volunteers. And throughout the year, we draw on about 400 volunteers to deliver some of our programs and to help fund the mission as well. So ultimately, our goal, let's see if this works, well, our vision is we really do want to rid the world of Alzheimer's disease and all other dementias. And whilst we're called the Alzheimer's Association, we do cater to any form of dementia that somebody may be experiencing. So we are doing this obviously through raising funds and promoting and all things research in our world. Our mission is that we want to end Alzheimer's disease, and we do this through the global research, accelerating global research, driving down things that contribute to the disease, so driving risk reduction, early detection, and maximizing quality care and support. And our symbol there, the first circle that you can see symbolizes the person, or the brain of the person, people dealing with the disease, and the second circle signifies the beaker, the science beaker, so and the research that goes on in our organization that we support. We have 6 pillars currently. One dealing with concern and awareness, raising concern about the disease and awareness about the programs that we offer. We have a whole pillar on advocacy. We do this nationally and locally, advancing sort of public policy. We support bills across the state that can have a benefit to our caregivers and families dealing with dementia. We which I'm going to talk to more about, is where I sit, is enhancing care and support. We have the whole research pillar, so we fund money for raising funds for the research. We bring researchers together in an international conference every year. Obviously, we have to raise funds. All our programs are free, so we have to raise funds for our work, which is the development side of things. And although we have a separate pillar for diversity and inclusion, we it filters everything that we do. So again, just to say, we deal with every type of dementia. We always talk about dementia being the umbrella term. People experiencing dementia have some changes in their brain functioning, their thinking, their processing, but there are all sorts of different reasons why they may have that. And some things are treatable, and that's why we really encourage people to visit the doctor if they have any concerns, because something could be completely treatable. The most prevalent dementia is Alzheimer's disease, and some the next one would be vascular dementia, which is much more related to people with strokes and a history of heart disease. And then there's some other dementias that you hear less of, frontotemporal dementia and Lewy body. So they all have slightly different causes, and they will have slightly different presentations, although I would say that the end point is pretty, the later stages are pretty similar across the board. So as I said, we deal with all types of dementia. So just really want to just focus in on the care and support program, because we know currently there's around about 110,000 Hoosiers. I always say that, it's my English accent doesn't always sound good with Hoosiers, but we want to meet their needs. And actually, we're only reaching a really small minority of the people that are dealing with a dementia journey. So we have a 24/7 helpline. And if you know people in your personal life, if you know people through your work that are navigating something, have concerns about themselves or concerns about a family member, or are in the throes of caregiving, we just want people to know, if nothing else, that we have this extraordinarily fabulous helpline. It's 24/7. So this isn't a 9 to 5 disease. People have concerns and high stress levels in the middle of the night. So there's always somebody there, and they have access to master's level social workers. So we just don't want people to feel that they're on their own. The last time that phone line closed was during 9/11, and that was simply because the phone lines were down. So we're immensely proud of our colleagues. The calls get routed through to Chicago. If there's local issues, if they speak to a family and they really need to speak to a social worker locally, they're going to send it back down to me at the local level. We then run support groups across the state or across the country, but across the state. And here in Metro India, we currently have 15 care support groups. So these are safe spaces people can go to if they have any concerns, or they want to get local tips on local tips on resources, or like just tips on how to handle situations. And we train volunteers to run our support groups, so that they happen same time, same place, every month, unless it's awful weather. And I also run a support group for people who are living with a diagnosis. So that's fairly highly functioning people that have got insight, that want to connect with other people on a similar journey. We also do a stack of education programs, some for the general public, some for caregivers, again, run by trained volunteers. And we will talk to anybody that wants to listen. So we'll go into churches, to businesses, to community centres, to libraries. We will go in, and we just basically, again, want to just reach more people and ensure that they have access to information and resources. I also run locally a program specifically for people in the early stages. We really want people to remain as active and independent as possible, and part of that is socializing. So we have a whole sort of social program. Again, none of this is at any cost to anybody. We link in with physician offices, diagnostic centres, to ensure that they know we're here and they can refer people to us if they feel like they have families that just need more information. We have a stack of resources that we will share with families. We also have an online database which we run with AARP, which is where we send people if they're looking for local providers, if it's home care or memory care or an elder attorney or diagnostic centre. People can go online, they can use their zip code and find local services, and we will do that for them as well, because obviously we're catering often to a senior population, and they don't all have access to the internet, they don't all have access to printers and so forth. So we will do that search for them as well. And then we have a wealth of information on our website. It's a little bit of like a rabbit run. You just go down a hole and there's just heaps of information there. But the specific information for caregivers, they can go to alz.org/care. But our general local website is alz.org/Indiana. So that, I hope, was in a nutshell. Hopefully it didn't take too long, but I just really appreciate the time to share our resources.
Not at all. Thank you so much. Questions for folks? Does anybody have any questions that they want to ask? Anything that I wasn't monitoring the chat there, anything that is in there? I am, by the way, still trying to find that turn on closed captioning button. Thank you, Jamie. I did find what I needed to turn on in the settings, but I'm still not finding the button. So Krista, I'm sorry, I will do much better research.
No, you're all right. And I do have a question. How many people are you seeing with early onset and that are still in the workforce that you're working with?
That is a great question. I mean, I haven't necessarily got numbers, but yeah, if you get your dementia under the age of 65, we call that a younger onset. It happens, and it is rare, but we do see people because the impact on those folks is really, challenging, because you're in your 50s, you're not remotely expecting to get diagnosed with dementia. The journey to get a diagnosis at that age is really tough as well, because you get misdiagnosed constantly. So, and some of those folks are still working, and what we see is somebody could be in their job for 30 years, they always functioned well, and they start struggling to do the basics, and they start getting written up for things. And people, at the times I've met people that have lost their jobs because of poor performance before they got a diagnosis. So yeah, I can't put a number to it, but I think there's a reasonable number, and that's why we really love to work with businesses and their HR departments, because we want to raise awareness of this, because people can lose out on significant benefits if they've lost their job and they've not, gone on to long-term disability and then been able to get onto social security disability income. So yeah, thank you for that. That's a good question.
Yeah, no, thank you. And I, of course, would also encourage you to be working, referring those people to the vocational rehabilitation agency in their state, whether it's Indiana or wherever they are throughout the nation, because you do have a national, program, because they can assist them in retaining their employment if they need reasonable accommodation and navigating, that process, and they're really the experts in that field. So I always defer to them. When it comes to that, when anything's, disability and employment related, whether it's, obtaining or retaining, employment.
I love that. Thank you so much for that tip, because sometimes people can remain in their job if it is, structured in a way that people can still function and contribute. And that's the ideal, because, for people's self-worth and just, so I love that tip. Thank you so much.
Yeah, absolutely. So yeah, vocational rehabilitation in every state, all the territories, that's your go-to. When those instances happen, and it's a federally and state funded program. So
excellent.
Yeah.
Maria, can I say something? My name is Ina Pikar, and I so appreciate your presentation. Actually, Advocates was started because of the need of my father. We're from Ukraine, and he did have very severe vascular dementia. So I totally understand, different times and hardships of the family and so on. So we have a number of caregivers who are working with, older people we're working with. And I would love to talk to you further and to see if you would be willing to do, I don't know, educational, whatever. It could be via Zoom, it could be whatever. That would be incredibly important. And I feel like there is such a huge need in ethnic communities, because a lot of people don't know. They think that somebody is just a more complicated older adults, and it is, people could get so much help. So thank you so much for your presentation, and yeah, I would love to connect.
Yeah, we would love that. Whilst we say that we don't train staff, we do educate. So I know that sounds a bit pulling at straws, but yes, and one of our programs that we do is effective communication strategies, which I think is really useful for everybody that's dealing with people with some type of dementia, because ultimately a lot of it comes down to how we communicate, and if we adapt the way we communicate, we can bring down stress levels and some behavioral challenges as well. So that's often a good one. But I would love to talk. Yeah, we're just
That would be terrific. Thank you. Thank you so much. I will call and follow up with you and go from there. My strategy was to buy different types of ice cream cones, vanilla, chocolate, and whenever he will get agitated, I said, what do you like? Is it vanilla today or chocolate? And immediately agitation will go down. It's funny. Anyway, thank you so much for your presentation.
Thank you, Ina.
Thank you.
Maria, my name is Beth DeHoff, and I work closely with Down syndrome Indiana. I work at Riley, but my son has Down syndrome, and I volunteer with Down syndrome Indiana. People with Down syndrome have a much higher incidence of Alzheimer's disease than the general population. And Down syndrome Indiana has had some Zoom meetings about Down syndrome and Alzheimer's to try to support those families. So I don't know what sort of synergy that organization and yours can have, but I think it's important for DSI to have awareness of your resources, as well as you to have awareness of some of the issues in the Down syndrome community around this.
Completely agree. And it's so nice to meet you, Beth. And my colleague, Julie Collins, she's in Northwest Indiana. She has been partnering and they had this series of education sessions in the fall, which I think is the first time we've ever done that. I don't think we've met that community's needs very well at all. And now I know that in January we have a new caregiver support group specifically for families that have a loved one with both Down syndrome and Alzheimer's disease. So I'm really excited about that partnership.
Yes, great. Thank you.
Yeah.
Okay, any other questions? I don't see any hands up or anything. My question, I guess, is how is your connection with the local centers for independent living throughout the state, and do you need any connections there?
So we we have to sort of remain independent, so we can't recommend one community over another, but we want to make sure that they're all our local community centres and independent living, that they're all on our database with AARP, and I'm not allowed to get in there and change that. Every organisation has their own profile, so that's what we want to make sure, and I'm not convinced that our database is up to date, because people's organisations change names, change,
Right.
and so I currently have a volunteer that's making some calls to some local people to just try and get that updated really, but that is and then we will also talk to, sometimes we'll work with a retirement community and offer an education program to their families. So,
Okay.
yeah.
Well, I was just curious because their services, and there are 10 different centers throughout the state that have different areas of the state, and their services are all about helping people maintain their independence, making certain that they are able to know enough about you guys to be able to send those referrals, because information and referrals is a huge part of what they do.
Right.
To help people get connected with all the resources that are out there. So I was just curious about that, and we'll have somebody present about centers for independent living, I think maybe early next year.
That would be great.
Since we're right there. So I want to real quick, Ina, I'm assuming you were not yet at a place where you're able to do your part. I know she was having to travel between house and
I actually, I can, because I didn't happen in the car yet, so
Okay.
it's perfect.
Okay, I figured that was maybe a good transition, since there is that connection between why advocates came to be. So
Yeah, thank you so much, Jeremy. I think first of all, I want to thank you all for joining. It's such a busy and busy time of the year for everybody, and our goal is to make sure that this networking calls help all of us to spread the word about what we do, and to connect with people in the community, and if certain challenge comes up or something comes up, so that we could do kind of that warm, take somebody's hand and take them to another person and follow up that connection did take place. And that's what we're trying to do. I run Kids First Adoption Services, and I run Advocates Personal Care. And I so appreciate Jeremy doing such an amazing job of pulling communities together. I'll be really brief. With Kids First Adoption Services, I can't not to mention it, because that is something I'm doing for over 23 years. And what we do is we provide an option of adoption to families who need it. Every family loves their child. Every family cares. And, life could be hard sometimes, and sometimes people need options and they don't know what they are. So biological families always need to come to us. We place children from newborn to toddlers to young school age, and we're very intentional to make sure that we understand what are the wishes of biological family, what are the needs of the child, and work very hard, whether it is a child with certain disability. We just placed a boy with very significant heart condition who was born in Maine, with a family who is so committed. So anyway, that's what we do. We just, child is our number first client, and we really do care. We don't just care, it's part of our life. Holy cow, Saturday, Sunday, evening, weekend, whatever, just whatever it takes. And then Advocates Personal Care was started because of the need of my father. I am originally from Ukraine, and we immigrated together, and my father did not speak very good English. And when caregivers would come in, he would say, "Why did you bring her? She doesn't understand me. I don't understand her. She's sitting like in a library on the couch." So it became really hard. And when his condition after surgery, he had to go to rehab. I'm a licensed clinical social worker, but I never knew how much you really need to participate in your loved one's care, and how much you need to watch and communicate with nurses and all of that. And, I would go there 3 times a day, and I would leave, and he didn't understand somebody and act agitated, and they give him a shot of Ativan or Seroquel or whatever it is, and then he gets pneumonia for years, 4 days later, because he's just sleeping for 4 days. So that's how I came to the need of Advocates Personal Care. And I am, we feel so lucky to have Jeremy on board, and he's such an advocate for people, advocate for human needs. So with Advocates Personal Care, we could hire family members, community members, church members, people who are already helping and don't know that they could get paid for the time they are, providing this service. We could also work with parents of children who are parenting a child with disability. And there are not a lot of options. And you get a caregiver, and that caregiver doesn't know how to deal with emotional needs of the child, the behavioral needs of the child, and it just becomes a disaster. And anyway, so we are able to hire these individuals, and again, they need to be on Medicaid waiver. Yeah, that's the work we do. If you do have questions, please ask.
Any questions from anybody?
Thank you guys for listening. Yeah, and maybe you could share about what you do and events you do or whatever. Jeremy is way better at doing the whole thing, so I'll mute myself. And thank you again for coming, and happy and healthy holidays for you and your families. Thank you again for joining.
Ina, we did just get a question from Heather asking, what is the best way to refer families?
I can put my families to work. Jeremy, do you mind to put on the link that phone number if people would like to be hired?
Yeah.
And I can also put my personal number and my email address, and you are so welcome, to email me, to call me, and I will always respond.
Yeah, and you will also see in the chat my email address for Advocates Personal Care, which is jwarriner@advocatescare.com. And I did forget to ask this as part of the intro, that everybody go ahead and put in their contact info so that folks who are on the call can connect with that. I need to get better about sending out an actual document to everybody so you all know how to connect with people. Let's see. Maria is asking, on average, how long does the process take to adopt a child, Ina?
Sorry, I just muted myself. So, it really depends. If somebody is hoping to adopt an infant and they're in the program, of course, they would need to be, we approve them with a home study. people provide their profile book, and then all this information when we meet with biological parents. For example, yesterday I spent probably 2.5 hours meeting with a young woman and her aunt. They would need to choose profiles and choice 1, 2, and 3, and we would always contact, the family who is chosen by biological family. But we sometimes see scenarios where biological parent doesn't want to choose a family. They want to have a completely closed adoption. They don't want to have any visits or updates and pictures. And we're the ones who would look at the list of fully approved adoptive families. So again, to answer your question in a short manner, it could take somewhere like 6 months, and it could take 2 years. And it really depends on the need and situation. And sometimes we have families who come into us and need to do a placement of a child the same day. Like we had a woman who knew she will be incarcerated and she needed to place a 3-year-old. So family just started the process and we placed the baby the same day.
Wow. Okay.
But each family has to be home study approved. We cannot even present their situation until we did all the clearances and FBI checks and, sexual offense. I mean, there is a list of stuff. Thank you.
All right. Thank you so much. I still, and I say this all the time, I have no idea how Ina manages to add hours to the day because she is constantly busy. So, all right. If there are no other questions for Ina at the moment, then I would say we get into our speed round, and I will let Kendall Tilton introduce himself. So Kendall, you're up.
Like everyone else, I'm fumbling to find my mute button there. Okay. So I'm Kendall Tilton. I'm director of the Moving Forward Career Center for Noble. As an organization, we work with a wide range of developmental disabilities from birth through maturity. So all the way, so the full spectrum, providing therapy and residential and other services. I guess our big news is we have a date on our new building going up off of Shelby Street, right there south of Washington. That will have 9 set-asides for people with disabilities and limited income. So July 1st will be the move-in date, I believe. So we'll be starting a waiting list soon. So those are 1, 2, or 3 bedroom apartments. And again, it's right off Washington Street there, right east of downtown on Shelby. So if anybody's interested in housing about that time for someone, it will be a nice little space.
Kendall, what is the what's the way, how does somebody get on that waiting list if they have a client who needs that?
Email me.
Okay.
And I put my email in there. So kind of excited to have a date finally after 4 years of
Yeah,
waiting.
congratulations. That's great. So, and I know that there are a lot of people in need of housing. So thank you for that project. All right, Jamie, do you want to introduce yourself and talk about the New Year's Bash that's coming up?
Hi there, happy to. Thanks so much for putting on this event. Glad to be here. Great information. Thank you so much, Maria and John. That was awesome. Love the work that you guys are doing. And me here at Special Needs Living. It's a monthly magazine written by families and individuals with special needs that live in Indiana, and you are welcome to share it as a resource to families and individuals in the community that you think would like to receive it as a resource. Great stories that give hope, inspiration, encouragement, a lot of great resources, upcoming events. And we do feature and highlight local nonprofits that do work to serve those with disabilities. So if you would like to share a story or be featured in one of our future issues, feel free to email me or reach out. I put my contact information in there. And in January, on the 21st, we are putting on a New Year's Bash. It's our second annual event, and this is for families and caregivers and support partners all across the board. And we have a full side of the room for, you know, teens and kids and adults to hang out and have a good time. And then we have a section for families and caregivers and our support partners. And there'll be food and entertainment and music and dancing. And it'll be a great way to kind of kick off the new year and make some great connections. So you're welcome to share that event as well. And if you're also interested in being a part of that or helping in any way, you're welcome to email me as well. So thank you so much for letting me share.
Thank you. And I do want to say Special Needs doesn't just put out a magazine. I've gotten to attend one of the events that they put on, and they really do amazing work in trying to make certain that families are aware of the supports that are out there. So thank
you, Jeremy.
Yeah. Jessica Carmen with Child Care Answers, and thank you for being here. I do want to point out Child Care Answers is not necessarily an organization that is disability focused. So I'm thrilled that you're here, because I know you guys get families who have disabilities, even though that's not your specific area. So thank you for joining us.
Of course, Jeremy, thanks for having us. Like Jeremy said, my name is Jessica Carmen. I'm the Community Engagement Specialist here with Child Care Answers. And for those of you that don't know about us, we are the local child care resource and referral agency that serves Hamilton, Hendricks, and Marion counties. So as in the name of our organization, kind of the biggest bucket we do is help families locate child care programs and resources to fund those and pay for that. But we do a lot of education and advocacy and things as that in that nature as well. So one big thing that we do, and I am going to drop a link to it in the chat, is we have an entire page on our website dedicated to inclusive childcare. So we do get families that have children with disabilities, and they just don't know where to start in finding appropriate childcare, or they're at a loss of how to advocate for their child with disabilities and kind of what their rights are and what to look for. So we have an entire page on inclusive care. We also partner, I know that Jeremy has worked with one of my coworkers, Jamie Listen Spears, before. We do different community presentations and education as well with different community partners. For example, accessibility is someone that we work closely with. We actually have, we're partnering with them in a workshop in March. So I'll put that information in the chat as well. But really just a resource for families. And we can connect them to other community resources as well when they just don't know where to start. So I'll put all of that in the chat as well as my contact information. So if you have any questions or anything like that, you're more than welcome to email me, call me. And if I can't answer it, I will direct you to the person that would be the best point of contact.
Thank you. Thrilled to connect with you guys today. Kaylin, you want to talk about yourself?
Yes, of course. Hello. I am Kaylin Underhill. I am a health educator at the Hamilton County Health Department. Sometimes my partner, Jim Ginder, is on here, but he's not here today. But I just wanted to put it out there that we're kind of slowing down with our educations with schools, kind of going towards more community-based right now, just with the students being in break with the holidays coming. So I do have like a quick course fact sheet that I'm going to put in the link. If anybody's interested, we do a lot of educational topics. We can train you with CPR. We have all other topics to talk about that are free of charge too. So I have a link that I can put in the chat that you guys can click on, and there's a bunch of different topics in there, probably over 30. So I won't name all of them, but I just want to say I'm glad to be here. I started in this position back in June, and I was actually Jim's intern beforehand. And my main goal was to kind of see like where those gaps are as a health department, where we can kind of focus on different communities. And this is literally one of the ones that I was most passionate about. So I'm just glad to be here.
Thank you. I'm curious, and so folks know, one of the first things that we did when we created this network, um, they asked for a resource guide that they could share with the schools about the different, not only rights of students with disabilities, but also the different resources that are out there. And has that been useful? Did that get out to everybody?
Yes, yeah, Jim has sent it. He knows everybody in the county, literally. So he sent it to so many people, I couldn't even start naming them. But yes, very thankful for that. Thank you for sending that to us.
Great, fantastic. Beth DeHoff, would you like to introduce yourself? There.
Sure. Sorry, I have to like move my mouse in ways that it doesn't want to.
That's fine.
Hello, I'm Hoff, and I am professionally the financial resource coordinator in the Riley Hospital NICU and connect families with all sorts of programs. So I always like hearing about your programs. Childcare Answers is one of the ones we use a lot. And I am also in this group representing Down Syndrome Indiana. I serve on their policy committee, and so I just take a share of the meetings for them as well. And I have no huge updates from either of these organizations. However, one thing I do want to call your attention to that's going to affect our communities a lot is the unwinding of the public health emergency. Currently, nobody is losing Medicaid and hasn't for a really long time because of the public health emergency. And at some point, that's going to end. There will be a 60-day notice of it ending. And so we know it's not ending in the next 2 months. The FSSA is starting to send out mail asking for information to update to prepare for this. There is a real danger that if they send out mail and they don't get a response, they will deny Medicaid once the emergency ends. So this has huge implications for our families and for our individuals with disabilities on waivers. Absolutely, it shouldn't end their Medicaid, but I'm concerned that state caseworkers who don't really know what they're doing with the Medicaid will do some of that will have to help people pick through. So I just wanted you all to be aware that probably next year at some point this is going to happen. And families are currently getting notices they're confused about. I get a lot of calls like they're asking for my income, but they shouldn't need my income. All sorts of confusion about notices that are going out. So just wanted to make you aware of that, something we're really aware of here at Riley.
Thank you, Beth. And can you, I'm just going to ask, will you please keep us in the loop on that as the year progresses?
Absolutely.
I feel like you may know before, definitely before me, what's going on with these things.
Probably. I am, as I can, attending the CMS unwinding meetings. They have one about every 2 weeks to update us on issues. So I attend that as I can, and I will certainly let you know when I hear anything about something coming down the pike.
Thank you. And if there's something outside of a monthly meeting, you feel free to email me and I can get it out to people.
Perfect. So, all right. Thanks very much.
Thank you. Heather Wildrick, would you like to introduce yourself?
Sure, thank you. Heather Wildrick Coleman, with Assistant Director with Community Partners for Child Safety at Firefly Children and Family Alliance. Genevieve George, I don't know to what capacity and how frequently she attended these meetings, but she had been our outreach coordinator, and she's went on to a new position, career path, and we wish her well, but I'm here today. So we were formerly Children's Bureau and Families First. We merged last year. We revealed our new name in April. Hopefully folks are aware of that. And so that merged both of our agency services. So foster care, adoption, residential service, inpatient services with our Courage Center, our residential shelter facility in Indianapolis, survivor services, recovery services under that Families First umbrella, a whole wide scope of services. But I'm specifically here to talk about Community Partners for Child Safety. I represent the Marion County program. I will be sure to share the map that shares all the various regional offices we have the contract for about a third of the ones across the state, but we are a free and voluntary in-home case management program, much like Child Care Answers. We are a resource and referral agency. We will work with anyone who is the primary caretaker of children 17 and under. A new highlight or a new thing to share with you is that we will begin also working with pregnant persons after the first of the year, which is a little tweak to our service standards. I like to say that we're Jack and Jills of many things, but masters of none. So we get into the home and pack the family's needs of what's going on with the family unit, and work towards goals to help keep them happy, healthy, and strong, building upon the 5 protective factors that keep families happy, healthy, and strong. And we connect them to those referrals. We have some in-house things that we can do with families. And so it's really great to be on this call, to be learning about all the various resources that are available to our families. We do safe sleep classes. We do a child sexual abuse prevention and awareness training for adults for free of charge. We have a parenting ed class that we run on about a quarterly basis. We have a lot of outward facing educational initiatives for families, as well as that case management piece. So I will be sure to put the map in the chat to refer folks, because it sounds like we've got folks from all across the state on this amazing call. And yeah, so always looking to partner and become just so much more aware of the resources out there, so we can direct our families to those appropriate resources that they present to with when they reach out to us. Oh, real quick, the only caveat about our services is that you cannot have an open case with healthy families, juvenile probation, or DCS, because essentially we're all tapping into the same funding streams. Thank you.
Okay, good to know. Thank you so much. Thrilled to have you with us today. Raquel Knight, would you like to introduce yourself?
Good morning. My name is Raquel, and I am with the Stanley DeKemper Training Institute. So we do a lot of trainings, and right now I don't have any updates, but just kind of trying to get familiar with all of the programs in the community to see who we can partner with and what we can add. We do a lot of private training, so it would be cool if we could connect with some people to get some things going education-wise in the community. But that's basically the main thing for us right now, is kind of learning what's out there.
Wonderful. Thank you. And was the idea behind connecting this network to talk on a monthly basis, and it doesn't change. So keep coming back.
Thank you so much.
Yeah. Courtney Locke with Fuse.
Hi, Jeremy. Good morning.
Good morning.
Thanks so much for hosting us.
Thank you.
I am Courtney. Like you said, I am from Fuse. We are a parent-to-parent organization. I have a 10-year-old who is autistic. I first met Jeremy last year when we hosted the Inspiring Abilities Expo, a disability resource fair in Greenfield. That is coming up again this March. It'll be on the morning of Saturday, March 4th. We are still looking for vendors. We are still looking for sponsors, and then we'd love if you'd get the word out to get us some attendees as well.
Thank you. Do you want to maybe post a link for how people can register for that?
Yes.
That would be great. Please add that to the chat. And Capital Station. Who do I have on from Capital Station?
My name is Courtney Hunt. Hi, Jeremy.
Hello.
I work at Capital Station, and we're a HUD housing facility for seniors who are 55 years and older. And so my role here is to connect the seniors here to resources so they remain living independently. We don't want them to go to higher level of care. And I also bring in education and wellness programs for them to participate in. So I love this opportunity to be able to learn about resources available for them. My company that I work for is called United Church Homes, and they are now going to expand to a program that's called NaviGuide, and that will be something that the community will be able to access. So if you had somebody, a family member who had a disability and they needed resources, they would be able to call in and get like a case manager to help them navigate whatever resources they would need. So like if they were getting discharged from a hospital or physical therapy or things like that in that nature, we would have have like a resource hub for them. So all this information is very good and useful to me. So thank you everybody for sharing.
Thank you. Did you mention Ambassadors of Hope?
I did not. I am also the co-founder and CEO of my own corporation called Ambassadors of Hope, where we do a parenting education program for families to keep them from becoming involved with the Department of Child Services. And we also host a foster parent support group 4 times a month.
So I'm going to add in there also that I got to meet Courtney when she was doing training for accessibility on trauma-informed care. So, and that was through Ambassadors of Hope as well. And that's something that I would encourage every organization to go through at some point. And Krista Martin, would you like to introduce yourself?
Oh my goodness, I'm going to try my best. So Krista Martin with Direct Employers Association. I am the Disability and Community Outreach Specialist. I work in all things vocational rehabilitation throughout the country. We're based in Indy and actually have a position available and with Recruit Rooster team as well, if you have any qualified candidates that might be interested. And so Kendall, expect an email from me. I work with all of our CRPs. So if you're in, employment of people with disabilities, you're my people, and we want to, connect you and partner with you and provide free resources to hopefully increase positive employment outcomes for people with disabilities throughout Indiana. So. And also, I will preface this too. So we started the Indianapolis Disability Talent Showcase, which is the 3rd Thursday of the month from 1 to 2. It's going to be at Easter Seals Crossroads in person and on Zoom. So if you can't get over there to Easter Seals in the Indy area, then you can go online as well. And it's a monthly meeting that we started. We kicked off in September to connect providers and employers and job seekers with disabilities to be able to connect. So
yeah, I got to attend one of those a couple months ago, and it really was a fantastic meeting. So I would encourage folks to let that resource.
And we did have Casey Weldy with the Helen Keller National Center had 2 job offers for 2 of her candidates from the November meeting. So, we're also interested in tracking those placements and showing that this, bringing the providers, employers, and the job seekers together is going to have those outcomes. So the more we can show that, the better. And so 2 people got job offers out of the November meeting. I don't know about the December meeting yet. That was last week, but we'll see you guys in January. Yes. If you're interested in attending, just reach out. I'd love to connect you, with that network as well.
Yeah, wonderful. Thank you. So we have a couple minutes left, and Maria and John, you guys started us off. Do either of you have anything that you want to add before we wrap up for the year?
I'll just add that it's nice meeting everybody. I think Maria spoke earlier. I've been here for a total of 11 days at the Alzheimer's Association. I am the program manager for the Metro Indy area. So this was very helpful and very informative, and I look forward to meeting most of you and connecting.
I think thank you for letting us speak earlier. And this is a really busy time for everybody, obviously, but it can be a really challenging time for families dealing with dementia. When families come together, if you haven't seen family for a long time and you suddenly see a loved one declining and finding it difficult in a sort of busy social setting, our helpline gets quite a lot of calls during and after the holidays because families start seeing some real signs that are causing concern. So just a reminder about our national 24/7 helpline number for anyone that you come across in your personal and work life. Just make sure people know that there's someone they can talk to. And I wish everybody a great hopefully a break. Hopefully people can get a break for the season.
Yeah, thank you so much. And with that, I do want to add, and this was something we always covered every year in the hotel industry. simply the fact that the holidays, while they are such a joyous time of year for a lot of people with disabilities, whether it's Alzheimer's, dementia, or physical disabilities that keep them from engaging with their community, depression and mental illness are really a huge issue during this time of year. So cherish your families and look out for those things, because this is the time when we are all getting together with people we don't necessarily see all the time. So and please have a wonderful, happy holiday season. So thank you all. We'll see you in January. I believe we'll be back on the 4th Thursday of the month, but I'll get something out to you with invitations within the next couple days, if not the next week. Anybody that I missed? I think we got everybody today. All right. Thank you so much. Ina, you got anything you want to add at the end of the year? Ina may be driving to the office. So, all right.
Sorry, it just took me a minute to unmute myself. Sorry about that. No, just as Maria said, take time for yourself, and hopefully there is opportunity to take time for yourself and enjoy, and just, yeah, have a good, peaceful holiday season. And thank you very much for joining, everybody.
Thank you all. See you in 2023. Happy New Year.
Bye.
Happy New Year.